Good afternoon. I am Dr. Laura Hockman, and let's get started. Today, I have our guest, Dr. Cynthia Chen-Joea. She is a physician. She is a coach specifically around designing your career. So, Dr. Chen-Joea, thank you for being here today. And
Thank you so much for having me.
yeah, I'm excited. This is going to be good. Um, and before we start, Dr. Chen-Joea, her opinions are her own. She is a physician. She's not your physician. And what she says today has no bearing on any affiliations that she is affiliated with.
Thank you so much.
All right, let's get started. Today, we're going to talk a little bit about career by design, and we'll talk a little bit about creating balance. Um, Tell us a little bit about when we say career by design, what are we talking about?
Yes. So, one of the things I think that is the hardest for physicians, especially new physicians who are graduating residency, is really looking at what they enjoy. And I think one of the reasons physicians get burnt out is that they have this idea of what it is they're supposed to do when they graduate. And I'm not saying that's the only reason. I think there's a lot of reasons why docs get burnt out. But I would say that's one of them. So I'm a family physician, and I'll give you an example. Is I would say graduates, when they graduate, they think, okay, family docs go into outpatient medicine. But if you're a doctor that actually doesn't like outpatient medicine, after some time, you're going to get pretty burnt out because you're doing the same thing over and over and over every day that you don't enjoy doing. And so, as a physician career coach, one of the things I love doing is actually helping you figure out what it is you actually, as a doctor, like to do. And if we're able to piecemeal all of those things together, let's say maybe you want to do outpatient only 1 day a week or 2 days a week, and then you're actually also interested in research. Maybe you're also interested in administration. Maybe you're also interested in, X, Y, and Z. As family docs, I know I'm interested in a million different things that we can actually curtail your career day by day or week by week or month by month exactly to what it is you enjoy doing. So you wake up every day excited doing something you actually love. And so there is this concept of idea of life by design. I like to say career by design, where we can actually sit down, do the hard work, and see what it is you like to do and build that career of your dreams that you enjoy doing every day.
I love that. Thank you. How do you go about, so just say a physician comes to you and says, "Hey, I I'm unhappy. I think I need to make a change." How do you go about that? And I think this is kind of a read my mind question. So what I'm thinking is, we all decided when we were kids, I'm going to be a doctor when I grow up. Here we are. We arrive, and then we're like, well, now what? And many of us are unhappy, and we'll talk about balance in a little bit because I do think that that comes into it as well. But how do you go about figuring out what that balance, what do you how do you how do you go about helping someone figure out, okay, they've done this, they love the medicine part of things, but maybe just life isn't quite fitting? Or how do you go
Yeah.
about helping people figure out what it is?
Um, I mean, there's a couple of parts to your question. I'd say what that balance might look like to every person is going to be different. Someone might only want to do, let's say, part-time medicine and part-time non-clinical or part-time clinical. Somebody else is totally okay doing, let's say, 60, 70, 80 hours clinical, and that is what they want to do. And so I think one of the first things I actually do as a career coach is I have an intake form that really focuses on what your true values are. And if we can figure that out first, we can figure out the rest of your goals and whether those things align with your values. Because I think that is the most important thing when we're working with our career, our job, our everyday life, is that it really has to align with our true passion, our North Star, what our values are. And if that's not the case, I think a lot of us can be miserable and go down that path of just not being happy in our day-to-day life. But if we can figure that out early on, that's usually the first thing is we look at your values and then we try to align everything else with values. A second thing I look at is I like to actually develop a mission statement around your values, mission statement of your career, and then a mission statement of your life. And it makes it so clear sometimes when you just see that written up as the first thing you see every morning. All of your decisions, all of your tasks, everything revolves around that mission statement. And it gives your life so much more clarity and joy when you're focused on that one thing. And it's different for all of us. So we kind of sit and figure that out for you.
That's such a fascinating idea of a I have a mission statement for my business, but
Yeah.
having a mission statement for your life,
Yeah.
can you give an example of what that would look like?
Yeah. So I sat down and did this work for myself. And I can share a little bit of that. And we all have different seasons in our lives, right? So, one of the big things that changed for me is I had a baby. I got pregnant and have a baby. My mission statement since that point, and it is still is today, is I want to be present with my child and my family. And that is the most important thing to me right now is presence. I was finding in the midst of being a doctor, when I came back from maternity leave and I went back to work, I started falling into my old practices of just really overworking. And I found that I was really unhappy. I love being a doctor, but I was unhappy because at this season in my life, and this mission statement can change, right? But at this season in my life, my mission statement is revolving around my family and watching her grow up. So I actually have that mission statement written on my phone every day in the morning when I get up. I see that and I do my whole work. I make decisions around my career, the jobs that I take, my actions, everything around that, because I want to prioritize her and watching her grow up right now. And that doesn't mean I still don't love what I'm doing as a doctor, but for my life right now, that's what I'm focused on.
That resonates so much. I even before I had kids, that's always been my same thing where I want to be present with my children and you know, part of why I even postponed having kids because I could have popped a baby out in med school or residency, but that wasn't the type of mom I wanted to be. I wanted to be there.
Right.
I wanted the quality, but I also wanted the quantity. And I
Exactly.
mean, I even picked my specialty around spending time with my kids. So that I didn't have yet. There were
Yeah.
no kids to be
You
had.
were
No,
preparing.
well, I was fortunate that I ended up having kids, but that makes so much sense, and I've made every decision up to that point. And I was just listening to the book Ikigai recently, and
Yes.
loving it. Have you read that one?
Yes.
Oh,
I
I
haven't
love
read it,
it.
but I've heard so many good things
I
about it.
love it. I'll paste a link in the comments here when we leave to that book. Um, but one of the things I was reading actually when I was driving to work the other day, and we've all heard "live in the moment," every second counts. The way that it was worded was so poignant. Maybe it was just that I came at the right time, but it was, every little second. This is the only second in time you're going to be living this second.
Yes.
And I
Yes.
love how that was worded. Like, I'm not just you're not going to get this time back. It's not this nebulous. It's just this moment is the only time you will be in this moment. So make the most of it.
Yeah.
And
I
that
think
to me was just, ah, uh-huh.
I I love that. I love that. It's waking up every day with purpose and intention and making your decisions around that. And so I'll say when I was bringing home so much work from before before I decided to resign, I was bringing home so much work and I was when I say present, I'm sitting down with my daughter. She's eating. I'm trying to do her bedtime routine, which is a non-negotiable for me. Um, but I wasn't present. And what you talked about being exactly there in that moment with my daughter, like watching the world through her eyes, seeing her laugh and not even being present, being able to enjoy that just really, really, um, it really, really hurt me inside. And I knew I had to make choices around that. And
Yeah.
so, yeah, that was a big reason why I ended up, so for me, I ended up resigning from my full-time job, and now I do several part-time, both clinical and non-clinical jobs. Again, everything was made with intention and choice around my current life statement, which is I really want to be present. I want to be here for her. Every moment counts. And it doesn't count, I feel like, if you're not actually physically there enjoying it.
Right. Physically
Um,
or mentally, right?
yeah. And so much of our negative emotions, I think, come from the unknown. But if you're able to remove yourself all of it takes a lot of practice. It's a daily practice for me. I'm able to remove all of those feelings, about the unknown, fear, anxiety, all of those negative emotions and just be present. I find that I am so much happier just being present and just enjoying that moment, like you just said.
Exactly.
And so that's a practice I do on a daily, and I don't know about everyone out there, but I know I've been much happier doing that.
Yep. There's no future. The future hasn't come yet. The past is finished. So just
Exactly.
be in the moment.
Yeah.
Yeah, I agree with you. Well, and it's cool because, kind of getting back to the career by design thing, I think we're so programmed in our training to do what we're told to this is the only way. Even a lot of the physicians I speak to who are coming out of training, they only know one way. And even private practice is so foreign. It's so foreign. And it's
Yeah.
not that foreign. Um, but there's so much more, there's academics, there's hospital employed, there's private practice, and then you go like
Right.
way over there, and then there's a whole other world. Um, so that's a hard step. Do you see physicians? What kind of struggles do you see in making those steps over into non-traditional pods?
Yeah. It's not even non-traditional or non-clinical. Sometimes it's even just letting go of your current job because that's what you thought you were going to do, um, forever. One of the things I see physicians struggling with most is letting go. It's grief. It's letting go of your idea. It's your expectation of what you thought being a physician would look like for you. Sometimes it does have to do with, let's say, the specialty you choose. Sometimes it has to do with, societal expectations, like family medicine is going to do outpatient, right? So what if I didn't want to do outpatient? What if I wanted to do inpatient or something else? There's research, pharmaceuticals, right? There's medical writing. There's so many different things. Working in media. Um, but maybe what you thought going into medicine for all those years that you held on to was seeing patients in the clinic, and that was your idea of what you thought success would look like for you. And so letting go of that picture, that expectation, maybe it's from you, maybe it's from your family, it's hard. It's letting go of an identity that you were working towards, an identity that maybe you have really identified yourself as. It's part of who you are. And if you're letting that part of go, it's almost like you're letting a part of yourself go. Um, and that is something that, we talk about and we work through. The flip side is it's the chapter of a whole new beginning for you once we do figure out what your values are, what you love doing in medicine, either clinically or non clinically. Um, it is the door is wide open. You have so many options, and it is what you make of it. And so there is always that grief, but I think everything is, 50-50, two sides. What's the opposite of grief? There can come optimism and happiness and joy. And that's the future that we are trying to walk towards and strive towards.
Yeah, change is hard, and it definitely comes with a lot of grieving for what you thought was going to be, for sure. For sure.
Yeah.
Um, well, let's talk about balance for a little bit here. So, um, I am a recovering perfectionist. I'm a recovering imposter syndrome person, and I'm a recovering no boundaries breaker.
Aren't we all
Yes.
as physicians?
So, and if you're not, please work on it. So let's talk a little bit about, sometimes people are in the right job, except the misery comes not from the job itself or where they are, but it's about not being able to create that balance in the right situation. So, talk a little
Yeah.
bit about balance and how we as physicians can create that in the positions we have. And then maybe, if that doesn't work out, then it's time to call it.
Yeah. Balance, I mean, so much around finding balance, I think comes from within. You could be working 20, 30 hours, normal hours, and still be very burnt out if what you're working towards isn't aligning with your, let's say, inner North Star or your ikigai, right? And so, again, we talked about that as the first step. Um, with balance, I think you finding your own boundaries of what works for you and what doesn't work for you, and communication, I think is also something that's really important. Um, I'll say and I think it takes a lot of work to know what works for you and what doesn't work for you, right? So when I was really burnt out and someone told me to, let's say, do a mindfulness exercise, I would be like, "Huh, that's not going to work. There is no time. I'm doing a million things." Um, I think going through that and now being where I am today, it does take a lot of um, inner reflection and intentionality of the choices that you make and what works for you and what doesn't work for you. I know that sounds so vague. One of If you are so disconnected from your feelings of your basic bodily needs, a lot of times we are not connected with what it is we actually want. It sounds so simple, or what it is that we actually need, right? It sounds so simple, like, what is it you want? And we can work towards that. Some people can't, like physicians, a lot of people don't know. And I've had doctors where I've asked them, what is it that you're passionate about? And they can't tell me because they've been told what to do their whole life, right? You talked about, doctors can't eat, can't sleep, can't use the bathroom when they need to. And we've been told this is what you need to do, this is what you're supposed to like. They can't tell me what their passions are. And so I think that's really hard for me to hear. Um, yeah. And so one is a mind body scan. I don't know if that's something that you've ever done or our listeners have ever heard about, but doing a mind body scan can be helpful if we can't identify what it is we actually need for ourselves. If it's saying, no, I can't take on this project, or no, I need a little bit more time, or no, I need a mental health day. I say, like, doing a body scan oftentimes helps. And how I recommend my clients do that is to write down the statement of what it is they want to do, their choices, let's say, 2 choices, whatever choices it could be. Write them down and see how you feel on the inside when you react to those 2 choices. Like, if you're choosing this job or this job, let's say, write them down and see how you react. And oftentimes, your body will tense up if it doesn't like that choice, and your body will release and open up if it does like that choice. So that's option number 2, something that you could try if you are actually unable to identify your emotions or your passions or whatever it is that you're feeling around a choice or a decision that you need to make. I'm not sure if that answered your question.
Well, I like it anyway. Does it matter? It was great. That was so good. I just did an exercise recently where I wrote down all the things I've ever done in any of my jobs. This is, my medical jobs, my jobs in college, my jobs in high school, like the whole everything. I did not have a job in medical school because we all know there's no time for that. Um, and it was interesting what came up, and a lot of it was, not just what did I like, what did I not like, what did I like about it, what did I not like about it, how did it make me feel? And it kind of was like, oh well, gosh, duh, that's why I don't like this part of the thing that I'm doing, and that's why. And it just seems like, oh, that would have been so obvious, and I just that seems like it was so obvious, but it's like when someone explains something super simple and you're like, oh, I get it. I get
Well,
it.
there's so much going on in our heads sometimes. It's hard for us
Right.
to shift through all the information. So, actually writing it down is another great way of figuring something out for yourself. And so, if you write it down and you go back to read it, and then you go back to read it again, and then you go back to read it again, let's say tomorrow, the next day, the next day, the next week, the next month, oftentimes you figure out what it is you're drawn to, what is calling out to you, and what, is not working for you. So another another great exercise to try.
It's like journaling where, gosh, I'm trying to think. There was something I was doing. Oh, this is what it was. I was at a thing, and it was a business conference, and one of the things was, hey, just write down in the journal. They had these prompts, and I'd never done journaling before. This was recent, so I was like, okay. And so I was writing down questions. The first question, whatever it was I don't remember whatever the question was. I was like, I don't know, but I guess I'll just write whatever comes to mind. And then I ran out of time before I was done writing, and I was like, "That's right." I was like, and then I picked it up. I'm like, "Oh my gosh. Oh.
And you can
That's
surprise yourself. Yeah.
yes."
That's
It was just
self-realization.
and holy moly, I keep telling my girls now, I'm like, "Journal. You should journal." Not that I
Yeah.
continue journaling, but I'm like, "You should do it."
I
Do as I
love
say, not as I
writing.
do. They don't listen, but, one day they'll grow up, and then they'll be like, "Mom, you are so wise."
You have to figure out a way to help them think that they want to journal. That's the key.
Exactly. Oh, it has to be
Make it
their
sound like their
idea.
choice. Yeah.
Yes. Okay. All right. If anyone watching this has ideas of how to get my kids to think it was their idea to journal, please type it in the comments at some point. Oh, that would be so good. Let's talk boundaries. I think
Yeah.
one of the parts of balance that we're missing as physicians is where we are taught to do what we're told. End of story. And I mean, a part of that is if we don't do what we're told or if we speak up against whatever, we could lose our jobs, we could lose our license. So, stakes are high. Talk a little bit about how we can set boundaries as physicians who are employed or even who own our own practice.
Yeah. That's a great question because I think if you're finding that you're burnt out, setting boundaries is key, right? And whether it is saying, you know, so if you're working for, let's say, a larger institution, know that they also want to make you happy. Um, Physicians are the key. They can't, run a hospital or a healthcare institution without physicians, right? You're the key player in that institution. And so they do wanna make you happy as well. And so standing up for what it is that you need and believe in and saying, "Hey, it's not just for me, it's for everyone," can make a huge difference. And obviously, using communication techniques that can help you get you what you want, is helpful. Negotiating and communication techniques can be really helpful, but that's really important. And so, whether it is, let's say, getting, and so your efficiency, I would say, is incredibly important. I always recommend, as a doctor, the thing that you should focus on the most is how you're using your medical degree. So, when we're looking at efficiency and effectiveness in terms of providing patient care, we can all do the best job when we're doing what it is that we need to do, right? So, like, my job as a doctor is to see the patient, and so what can I do to outsource everything else that is non-medically related? And if you're part of the conversation to help create that solution, your administration or your, institution is that much more likely to help you figure it out because we're all working towards the same thing. We're all working towards patient care and optimizing that patient care, right? And so part of that is, let's say I need more time to do this because of X, Y, and Z. Let's see if we can outsource this to someone non-medically related so I have more time to see the patient and finish my notes, for example, right? Or saying, "No, I really can't take on that job because I need X, Y, and Z." right? It's another way of asking for it. And there's all these different scripts and communication techniques you can use to help you get what you want, to be able to set those boundaries for yourself. At the end of the day, it is so, so important for your well being because if you're happy, everyone else is happy, right? If you're happy, you have better patient satisfaction. I mean, studies have shown that. There's less physician turnover. Studies have shown that too. Institutions are actually saving more money with less physician turnover. And so those are all things that you can use when you're talking with your administration and being part of that conversation that can help create a better, I would say, environment, working environment for you as a doctor.
Yeah. It's hard. It's hard because we're such people pleasers and we just want to say yes. And, seeing it from the administration's point of view of, well, why do we need to get a scribe or why do we need admin help? Because they're going to get their work done anyway. Never mind that we're the ones charting at like midnight and not getting enough sleep or time with kids, and which
Right.
obviously leads to the turnover issue, not just in individual jobs, but in medicine in general. So setting those boundaries is so important. And having an employer, I mean, on the employer side, having them create that psychological safety of like, what do you need? What can we do? How can I help you? Is so important.
Well, I think it's also you, like you as a doctor, what do you think you deserve? Right? And they're going to give you and treat you the way that you see yourself and what you deserve. So if you show up thinking, I actually deserve this time to, I deserve a lunch. And so how are we going to figure this out so I can go out and have a lunch, right? Um, I think conversations can happen like that. The other thing I always like to say is just be curious and ask questions why things are done a certain way. There's a lot of things that I think go behind the scenes. So I also I also work part-time in hospital administration. There's a lot of things going behind the scenes that maybe a doctor might not know about. And so just asking questions can get you so much more information and can also help your admin be on your side so that when it is something you're asking for or you're setting up for a boundary, they're so much more likely to be able to work with you to give you what you want. When we're talking about burnout and like systemic issues, so I should say I'm really involved in advocacy because for me, that fills my cup. That gives me a feeling of control and agency that I am doing something in terms of the sustainability of medicine moving forward for all physicians. And so on in terms of the advocacy, I think we as doctors need to continue to show up and be at the table to have those conversations. I'd say that that from a systemic point of view is something that we can continue to work towards, but that change can be slow. And so I think from, let's say, a microsystems perspective, setting boundaries from a physician's perspective, like interpersonally, I think is also really important for us to keep in mind and knowing that, hey, you deserve to be happy in your workplace. You deserve to take a lunch. You deserve to go to the bathroom when you need to, because you're a human and your well-being matters.
Yeah, I agree. I wanna echo something before we sign off. You had said to ask administration why they do things a certain way. And I think that's so big because it's hard for us to see the other side, and always thinking of us versus them isn't helpful to us or to admin. And it allows, by asking why things are done a certain way or being able to see it from the administration point of view, really allows for actual solutions and not just going at each other,
Yeah,
butting heads. So, yeah, I
I think
think
it
there's a lot to
creates
be said.
more empathy and compassion for everyone involved.
Exactly.
I think at the end of the day, everyone is working towards the same goal, and how we get there is might be different, and that's where the disagreement, might come up. But if we're curious and we continue to ask questions and stay curious and be open, I think we can solve just a lot more issues and problems.
I agree completely, completely. I'm going to get one question that we just got from someone that's been watching, and then after that, I want to hear all about how anyone can find you if they want. So here is the question: what are your views on the mental stress that doctors experience in their profession, and what steps do you think should be taken to support their well-being?
The mental stress that doctors experience in their professions, I think, are so high. We have such high expectations of ourselves. And I think people have really high expectations of doctors. But I think understanding that everyone's human, everyone is the same. We all have the same emotions, we all have the same mistakes. Offering compassion and empathy for each other can go a long way. Um, I forget the second part of that question
I'll put it back up again. What steps do you think should be taken to support their
for
well-being?
their well-being.
That's a big
Um,
question.
yeah, I don't think just traditional EAP programs at organizations is cutting it anymore. Physicians are burning out at a much earlier rate, at a much quicker rate than they have ever been before. There's doctors leaving earlier in their careers in medicine than ever before. Um, and I think that's because of the way the medical industry has evolved. And so I think, again, from a systemic level, advocacy for physicians, our working environment, and changing expectations and the culture of medicine is so important. When we trace medicine back to the beginning, right? We all know it was the first doctors were surgeons that were on cocaine, so they were awake all the time. It's just not sustainable anymore these days. The number of patients we have, the administrative load, the notes that we have, it's just really, truly not sustainable. And so we really need to change the culture and the expectations of what it means to be a doctor and how we are being looked at by society. And I think it's slow. It takes a lot of work. Um, and I would say that the advocacy occurs on a systemic level. On an individual level, I think it is protecting yourself as a doctor, knowing that when you are burnt out, it is okay to say no and go towards what it is you need at that time. And if it's a break, take that break for yourself because your mental health is the utmost importance. Everyone's is, but yours is really, as a doctor, you're affecting so many people and helping so many people. And we give and we give and we give, right? And we often put ourselves last. And so know that when you actually put yourselves first, it makes a huge difference and not just how you act and how you feel, but how you put yourself out there, how you treat your patients, how you treat your colleagues, how you show up to work. It makes a huge difference. And so, I think asking for help, seeking support, talking with your colleagues, those are all things that have been tremendously helpful for me. Coaching changed my life. I would absolutely recommend it. And often people ask coaching or therapy. I say, why not both? They do different things. And if it can help your mental health, I say go for it and try it and see what works. I don't know if there's one right answer for everyone. And that's where I think the individual coaching or talking with a friend or a colleague can be helpful.
I feel like what could be done to support physician well-being could be an entire day, not even just 1
Yeah.
hour.
Yeah.
Um, on the topic of coaching, tell us a little bit about what type of coaching you do, and if anyone is interested, how can they find you?
Yeah, so I'm a physician career coach for early career physicians. Saying that though, I have coached non-early career physicians, but I think my passion is specifically around those in the first 8 to 10 years after graduating residency or fellowship. And I created a company called Thrivation Coaching, and you can find me at www.thrivationcoaching.com. There's a lot of information on there. I love to coach on career transitions, burnout, imposter syndrome. all of the things that we just talked about because it's something that is really close and near and dear to my heart, things that I have gone through. And having overcome it, I think I'm in a lot better place. Much happier than what I was before. And it's something that I also want to share with all doctors out there is that, there is a way for you to, if you're burnt out, if you're feeling stuck, if you're unhappy with your day to day job, there is a way to find your way back to that happiness and joy again. And it takes a lot of work and dedication and commitment, but know that there is a way, and it's something I can definitely help out with.
Great, thank you. So thrivation.com, is that correct?
Yes,
Okay,
yes.
THRIVATION.com.
THRIVATION, thrivationcoaching.com.
Ah, Thrivation Coaching. Thank you. Well, thank you so much for coming on. I think, this was really helpful. I like the idea of the mind body scan of, if anyone's watching that has some big decisions, write them down, see how they make you feel on the inside, make your list of things that you like and don't like and how they make you feel and all of that. I think there's a lot to be said. And stand up for yourself, create those boundaries. It's going to be very uncomfortable, but a lot can be gained from that.
Absolutely. Thank you so much.
Yeah, thanks. I'm going to sign off and thanks for being here.
Bye.